Okay, so today we're going to discuss antisepsis in this video, which is basically chemical treatments to kill or inhibit the growth of all vegetative microorganisms on body surfaces. And it's living surfaces, so the common applications are on like broken skin from injury or cleaning before surgery. So antiseptics must be able to penetrate the tissue without causing tissue damage. This method does not always kill endospores. So we're going to watch this video to learn more about antisepsis. And then I just have a few questions on it.
For the first time, New Zealand has a sophisticated patient safety initiative that will reduce harm caused by surgical site infections. The Surgical Site Infection Improvement Program provides district health boards with best practice quality improvement interventions to help them reduce surgical site infection risk. The second to be implemented is the Surgical Skin Antisepsis Preparation Intervention. Standardizing the way health professionals prepare the incision site prior to hip and knee arthroplasty surgery ensures that all patients receive best practice care, reducing surgical site infection risk.
Preparing the skin before surgery is very important. Every square centimeter of our body is colonized by thousands and thousands of bacteria, because if one doesn't prepare the skin, one can, in the act of making the wound, take germs from the patient's skin into the patient's body. And some of those germs have the potential to cause devastating infections. It's an age-old question to be asked, what is the most effective skin preparation? The literature would tell us that there is nothing better than chlorhexidine and alcohol, or iodine and alcohol mixtures, and both are, in my opinion, acceptable to use.
There are two types of preoperative skin preparations that appear to be more effective at preventing surgical site infections. These are chlorhexidine gluconate plus alcohol of at least 70%, and povidone iodine plus alcohol of at least 70%. The benefits of using chlorhexidine gluconate include strong affinity for binding to the skin, high antibacterial activity, prolonged residual effects on rebound bacterial growth, and exhibits excellent activity against gram-positive and good activity against gram-negative vegetative organisms and fungi. The benefits of using povidone iodine include povidone iodine is generally associated with low toxicity and little irritation. Exhibits excellent activity against gram-positive and good activity against gram-negative vegetative organisms and fungi. It has short-lived persistent activity. Patients that are allergic to chlorhexidine gluconate should receive povidone iodine with alcohol of at least 70% as an alternative. More detailed information can be found in the Surgical Site Infection Improvement Program implementation.
Okay, so what is antisepsis? Antisepsis is the process of removing germs and microbes from the skin. Where is it safe to use? It's safe to use on the skin or tissues. What are the dangers of having surgery? And as you saw in the video, the gentleman said microbes on the skin can enter the body and become deadly. What are some antiseptics and their benefits? Antiseptics used is chlorhexidine gluconate plus 70% alcohol. It has a strong affinity for binding to the skin, high antibacterial activity, prolonged residual effects on rebound growth, bacterial growth. It exhibits excellent activity against gram-positive and good activity against gram-negative and fungi. Povidone iodine plus 70% alcohol, generally associated with low toxicity and little irritation. It exhibits excellent activity against gram-positive and good activity against gram-negative organisms and fungi. Has a short-lived persistent activity. And patients that are allergic to chlorhexidine gluconate should receive povidone iodine with 70% alcohol as an alternative. But both are able to enter deep into the skin without causing damage. So here's a picture of antisepsis with iodine and a list you can go over at your own time of all the products they use and the considerations you take on choosing which antiseptic you want to use. So thank you.